September is Ovarian Cancer Awareness Month. An estimated 21,000 women in the U.S. will be diagnosed this year with ovarian cancer. By the time symptoms get a woman's attention, the disease is usually advanced and harder to treat. With no reliable screening test, women like our next guest have become a vital source to help women detect the disease sooner. Several women in our live studio audience have won the battle, but they are fighting the war to help others thrive after an ovarian cancer diagnosis. Runsi Sen founded Ovarcome in honor of her mother, who passed in 2009, and Debbie Bispano, who also battled ovarian cancer, is now an Ovarcomer, we shall say. All right, welcome to the show. And Runsi, thank you. You have come year after year, and what's been amazing is that in your live studio audience, there are women who I've recognized that you have brought year after year, which means they are still with us.
Yes.
So the message to anyone who is facing a new diagnosis is that you can still be here. And Debbie, you were diagnosed how long ago?
9 years next month.
9 years next month. And you say, we were talking earlier before the show, that so many people focus on that 5-year mark, if they can just get past that 5-year mark. You say focus on every day.
Absolutely. For me, you know, I live between recurrences because I've had several recurrences. Keep living. That's my motto.
All right. Ovarian cancer is the deadliest gynecologic cancer. The risk of development is 1 in 78. And the reason why it's probably one of the deadliest is because it's one of the ones that's harder to detect.
Yes. So ovarian cancer, as you mentioned, still doesn't have a reliable recommended screening. And that is why when we go for our well women visits, we, you know, for women of age, we get our pap smears or our mammograms, but there is no screening for ovarian cancer, and usually 60 to 70% of the time it's diagnosed in advanced stages. However, I would also like to mention that when it is detected early, the 5-year survival rate for ovarian cancer can be greater than 90%.
Yeah. And you said women of age, and here's the thing, this is where a lot of people get stuck. They think, oh, I'm not old enough yet. Yeah. We still want to say listen to your body, and we'll talk about some of those symptoms in a second, but let's share the story of your mother, because you know sometimes we say you don't pick a passion picks you. Yes. And this cause picked you. Your mom passed within 11 months of a diagnosis. She exhibited symptoms but remained undiagnosed.
She did, and I was just talking to Debbie before the segment, is that she had all the key symptoms of ovarian cancer that we know now, but as a family at that point in time I had no idea what ovarian cancer was about, and so we kept doing rounds between doctors, but it was diagnosed, again, very classic story. She was stage 4 and a very aggressive kind of ovarian cancer, and she passed away within 11 months.
There's an acronym called BEACH.
Yes.
Tell us what that is.
So we came up with the BEACH symptom at Ovarcome. This talks about the 5 key symptoms of ovarian cancer, where B stands for bloating, E stands for early satiety, which means feeling full quickly, A stands for abdominal and or pelvic pain, C stands for changes in bowel and bladder habits, and H stands for heightened fatigue.
Yeah.
So
now, everything you just described can be the problem with so many other things that are easy to dismiss, right? It can be insulin resistance, it could be just all kinds of other things, and that is part of the problem as well, because we'll dismiss it because we don't want to think about what it could be.
Yes, but there is also the key word is persistence, because if all these symptoms together or in isolation persist for more than 3 to 4 weeks, it's time for you to go get checked.
Debbie, what finally brought you in to say, okay, can we check on something?
Well, I ignored the symptoms for several months.
Yeah. Now, did you ignore them because out of fear, or because you just thought this is none of these one things are such a big deal?
I didn't really know the BEACH symptoms then,
right.
And we were retired, we were traveling, and I thought I was eating the wrong foods. I was gaining weight, I was bloated, I was just uncomfortable, and it took a woman that I met touching my stomach and saying, I think you should have that checked out.
Wow. And Runsi, this is the importance of having women who have been through it to all share their information. This is the research that's so needed, because when you started having women all saying the same types of things, that's when you realize there are symptoms that we can recognize.
Yes, and you know, self-advocacy can get tiring, but that is the only way for ovarian cancer, because there is no screening or recommended test at this point in time. We have our Ovarcomers are our biggest advocates, and they can push the community, and like Debbie said, they can tell others to go get tested earlier so that they can be picked up.
And speaking of testing, there is a genetic component, but I want to make sure people understand if no one in your family has had ovarian cancer, doesn't mean you can't, right? Because sometimes we think, if it's not a genetic component, I'm fine, but that's not the case. However, if you do have a genetic component, we talk about the BRCA1 gene, that's something that we can at least know if something could be heading your way. You have that BRCA1 gene.
Right, I have the BRCA1 gene. I was tested after I was diagnosed with ovarian cancer, which means my chances of getting it are a lot higher than the 1 to 78. It's a lot higher. And I have 3 daughters, and they were tested. My whole family, nieces and everyone was tested. And 2 of my daughters have the BRCA gene too.
So what that means is they can be aware.
Right, and they are already getting, they're in their 30s, they're already getting mammograms. They have the CA125, which is a tumor marker. So they see their doctor and they're aware of it. And their knowledge is power, so they're...
Yeah, for all kinds of things. I know a couple of friends of mine with that BRCA1 gene literally chose to harvest their eggs, for example, so that if they want to have children later, that they don't have to deal with that part of it. All right, speaking of dealing with it, you were diagnosed in 2016, stage 4, a high-grade serious ovarian cancer. Now, when people hear the word stage 4, they usually think, okay, make yourself comfortable and you know, you won't be here long. Okay, you are a fighter. Let me see that. Lift up the arm right there. Look, Mama got a tattoo, right? And
it says warrior.
Yeah, warrior. And you're like, okay. So when you first got that diagnosis, what was your first reaction? And then that moment in your head to say, it's time to fight.
I was numb. My husband went with me, and we asked the doctor, "Are you sure?"
Yeah.
And I had my CA125 was over 4,000. It's supposed to be under 35 or something like that. And I was like, "Are you sure?" She said, "Well, I'm 99% sure, but I've been wrong before." But I was numb, and I thought, what am I going to tell my girls? I kept thinking about my girls. What am I going to tell them? But then in the same breath, I said, well, we can do this. We can fight this. We can live through this.
And it's kind of a continual fight for you. You've been through a lot, but it's worth it.
Right.
For you to be here and be with your girls.
My girls, my grandkids.
So you've done 38 rounds of chemo, 99 rounds of radiation.
I tell people I glow.
You glow. And you set off alarms at the airport, right?
Yeah, right.
All right, Runsi, when you created Ovarcome, even for you, after losing your mom, you know, obviously that's a hurt that you never really get over. But you can take your cause to help others. You grabbed this one and you created Ovarcome, and it kind of came to you as an epiphany.
It really did, and I always say this, that my mom's passing just lit this path forward for me for just to do my life's work. And Ovarcome is my life's work. My overcomers are my family. And Debbie talks about genetic testing. I wanted to mention also, as a caregiver and a daughter, I got my genetic testing done. I was negative, but the point is, ovarian cancer, only 20% of ovarian cancers are genetic, which means majority who get ovarian cancer do not carry the mutation. So it's so important to stay on top of your symptoms. And my life's work is to work with our overcomers and to give them the support.
As opposed to survivors.
Yes, we use the word overcomers and not survivors, because when we use the word survivor, it gives too much power to cancer. But when you say overcomer, the power stays with you. And so that's what we like.
What are some of the programs and actions that you've been able to do?
So we have many programs that we offer at Ovarcome, financial, psychosocial, informational assistance programs, like Overcare. We have a chemo care program. We have our events that we do, conferences and education.
In fact, you just wrapped up
our
conference.
2-day conference, yes, and several events and global awareness programs that we do and research funding, of course.
And Debbie, how important is it for you to, because when you're going through something, you mentioned that your husband came for you, but I can attest to, even going through some of my health issues, that you feel like you're bugging other people, or that other people don't understand. And so to have this village, if you will, how important is it to have an organization like this?
Very important. My doctor told me actually about Ovarcome, and I became involved. I go once a month to their online counseling. I've met so many wonderful, beautiful people from all over. I go to the conferences. I learn more information about, new research, new medicine. I mean, it's so important. And yeah, you're right. My husband doesn't. I mean, he's great. He does, but they don't understand. And a person who's never been through ovarian cancer doesn't understand. So being around all the other overcomers and hearing their stories and listening to the doctors and the research. Wonderful. I mean, I can't praise Ovarcome enough.
There's a possible vaccine to prevent ovarian cancer on the horizon, teaching the immune system to recognize and destroy those cancer cells. There's cell therapy, AI and ovarian cancer screening and treatment. All those things are being looked at. Global Till Talk Day takes place tomorrow.
Yes.
What will that entail?
So we founded Global Teal Talk Day in 2017, and the purpose of Teal Talk Day to encourage everyone to talk about ovarian cancer, because ovarian cancer is called a so-called silent disease. We want to break the silence. We want to encourage everyone to talk about ovarian cancer, to share the beat symptoms. So one of the best ways the community can show support tomorrow on Teal Talk Day is to wear teal and to share the beat symptoms and tag us with hashtag Teal Talk Day, so that the word goes around. We can amplify awareness globally.
And that's what's going to take, because believe it or not, one time breast cancer was one of those things that no one talked about. And there was no movement, and finally women got mad and there was a movement. And when you get that happens, you have like a 99% cure rate. That's what we need to do with ovarian cancer as well. All right.
Without ovarian cancer, there is no procreation. I mean, without ovaries, there's no procreation. So we need, that's more
protect
important.
those. Right. Yes. Runsi, thank you. Debbie, thank you.